Hello, everyone, and welcome to Zero Project Conference 2026, where we are talking about accessibility, crisis response, and ICT. But something I feel was missing from many conversations that I had over the last 3 days is talking about policies and about strategies. And this is why I'm joined by two beautiful ladies from way back from Australia. And I love the Australian connection. You have kangaroos, we don't have kangaroos, even though people keep mixing that up. But what you do will have soon enough is a really working Autism National Strategy. And this is the topic of our today's conversation here. So let me give you the floor for introducing yourself. Maybe let's start with Claire.
Hello everyone, my name's Claire. I use she, her pronouns. I was very fortunate to be the co-chair, the Autistic co-chair for Australia's very first National Autism Strategy, and learned a lot about co-design and really effective ways of engaging with the community, and got to see the impact that had, not just on the front-facing document that everybody can download, but also the way that impacted future ways of working with government and, set the standard, I think, for engagement with community. So it was pretty privileged.
And I had the pleasure of meeting Cheryl at the Autism Congress that we had in Dublin last year. Cheryl, can you introduce yourself now?
Yeah. So I'm Cheryl Mangan. I am the Chief Innovation Officer for Autism CRC, which is a research translation organisation based in Australia, and a network of partners all over Australia and New Zealand who are all working together to see equity and opportunity for autistic people. Our role in the National Autism Strategy was to help the government in terms of understanding what best practice evidence looked like in terms of what needed to happen in the strategy, and also in terms of inclusive community engagement.
So let's dig into it a little bit, if we can. When we are thinking about drafting an autism strategy, not only for the Australian perspective, but I think that you have the most evidence when it comes to that, what is the first step you need to take in order to draft a strategy that will be having the wisdom of the community, that will engage many stakeholders, and that will really address the needs of autistic people?
So I'll take that one. So I guess the first step in that process was really to understand what does the research say is best practice in terms of the areas that the strategy was covering. So areas like education, health, mental health, housing, justice system, all of these focus areas. And then in addition to that, and this was the work that we got to do, was actually work with the community to understand how do we best engage the community so that the most amount of people can have their say in the strategy itself. So that was kind of our starting point.
And getting a little bit deeper into that, how do we engage with the community?
Well, I mean, the team at the CRC did an amazing job, and what they did was, using the things that Cheryl's just talked about, they really set the scene for us, for the autistic people and the community, to be able to engage at our optimal best, right? And that's so important. Cheryl and I were talking about it a little bit before we came to sit with you, and what people don't necessarily see is the right engagement means that I don't have to then come to an engagement session thinking about managing all of my sensory needs. I know what to expect. I know who will be there. I know, what I need to have, or it's all there. And so I get to put my whole self into that, right? And that's hugely important. And what I also really love is that because we were all able to do that, it meant that government actually changed the way they think about us. They think about us as equal partners rather than, a group of people that kind of have to be managed, because we could perform at our optimal best. And I've worked with government, look at the colour of my hair, I've worked with government for a really long time, and that's really new, and it's made a huge difference.
And I think that it's also something very unique for you because you didn't concentrate only on, let's say, one side of the spectrum. We very often engage with other foundations and they are saying, oh, we are helping people who, for example, are verbal and are on the autistic spectrum, or oh, we are focusing on those persons who have both ADHD and are on the spectrum, etc., etc. So can you tell me a little bit more about the diverse groups you interacted with and how you did it?
Yeah, absolutely. So, absolutely critically, the first part of it was actually working with an autistic advisory group to understand who those communities were. And so, once we understood that, we also went back to the research to understand what does best practice say positive engagement with those communities look like. But we were really, I guess, the first phase of the National Autism Strategy included a massive national survey where we had 1,000 responses from the community, from all stakeholders, parents, carers, autistic individuals, professionals, policymakers, which was fantastic. It was great to see such a rich range of people and stakeholders come forward. But what we were really challenged around was, what about those people who have not come forward? What about those people for which a survey is actually not accessible because of technology, because of language, because of the big words, as we were talking about in the previous conversation? And so the work that we were commissioned by the Department of Health to do was to actually go out to those communities that didn't come forward in the survey and actually try and reach those groups. So they were culturally and linguistically diverse, people who had very high and complex needs, perhaps were living in a residential care setting, people who had an intellectual disability, parents and carers, so that we could understand the lived experience. So we had a team of 18, and when I talk about this work, I cannot talk about it without talking about the 18 strong team that we had behind this, majority autistic, working with us to go into people's homes, to run interviews, to give people an opportunity to have their say in the strategy and to talk about what's important to them in terms of health and mental health in the way that they could best express themselves.
Can I add to that too?
Yes, please.
Because of the work that the team had done in the beginning, we had a lot of information. And when we got to the point of writing the draft, we went back and checked. It was really important to me as the co-chair, but I know my other autistic council members, that we would create a document that anyone in Australia who was autistic could see themselves in. It wasn't just for a select few. I have friends with intellectual disability who are autistic. I wanted them to see themselves in that document too. So using the same methodology that we'd learned, we went back and sense checked. And we had to make changes because we'd got some of the things wrong, and that's okay. But yeah, I think it really led to a much better, I guess, product, if you want to use that word, but at the end of it, because it was so, and this team had helped us, or had really created trusted relationships to make it possible to do that, right?
I think one of the, let's say, buzzword that was even at the corporate session, for example, with Panasonic there, was the importance of co-design. You cannot build something for a group of people without that group of people. If we want persons with disabilities, no matter what kind of a disability it is, you cannot address their needs without knowing what the needs are. And I think that you are a living proof of how to make that co-design work in policies, because I think it's not something that is very common. Like, I remember when Autism Act was being enacted in the UK way back, it was such a struggle for the National Autistic Society to push through, to bring it to the table even if they had the government support. So I think that seeing the government of Australia being so open and actually not starting with only the small component of healthcare, but doing a full strategy going through all kinds of topics, I think this is truly remarkable. And I think that it brings me to one last question for you. What is the core of the strategy? So if another policymaker would like to scale it or think about bringing a similar solution to their country, what they would find in the National Autistic Strategy in Australia?
Wow. I think if someone else was looking at what we have landed with, I think that there's a lot of importance that needs to be put on the things that they don't see. There are so many issues impacting people who are, autistic people in Australia. How do you choose a select few to put in a strategy? So it's things like it's a long-term commitment. It's things like, really stopping and reflecting on what we've already tried that's worked. Can we scale it? Those sorts of things. They're maybe not immediately obvious. The other thing that I think, I want to come back to the importance of the work that Cheryl and the team did. By creating the optimal work, helping the government to understand, and by creating the optimal working environments for us to come in and have, we actually had the capacity to have the really hard conversations, right? Had we had to manage a whole bunch of things and go in and have these conversations, it would have been really quite challenging to talk about some of the issues. What do you leave in? What do you leave out? This is a group of people that we've heard are having these really big impacts, but it's not in scope. What do we do? And we could challenge as equal partners. And really, again, I keep coming back. I don't know if they understand the impact of the work that they did, but we could be our best because of the way that we were set up for success in the first part. And I think you said it best, Cheryl. Like, it's not. It's a long. How did you phrase it before? About it being like a long-term thing that we were just talking about. It's not. Investing in a long-term, carefully planned. She says it better than me. I don't know why I'm trying to take it for her, but yeah, those are the sorts of things you don't see. And one last thing, and I'll let Cheryl finish it up. It actually changed the way that the government was treating its own employees, and because they were setting up all of these optimal working conditions for us, and we would come in to Canberra as this council, and they'd set it all up perfectly, and then they'd take it away when we left. And they had all of these autistic employees going, and so they changed that, and they created those internal processes. So, yeah, I mean, maybe I went off track. I want to do that, but what I really want them to do is they've got to actually, they can read the strategy, they can look at the strategy, and then they've got to come and talk to us and dig deeper, because there's so much more that you won't see to make that happen.
Yeah. Anything to add to that, Cheryl?
I do have something to add to that. And I guess I really want to give a shout out to the organisations that we worked with. Because I don't know if you know, but the geography of Australia is massive, right? It's massive. So Claire and I live on opposite sides of the country. For us to drive to each other continuously, that would be about a week. So
5-hour flight.
it's massive. And so we actually, when we were approaching this work, we really looked for organisations and partners that were values aligned, that had the same core and the same heart and commitment to co-design and co-production and co-leadership of autistic people, and then worked with and through them and equipped them to have conversations with their own community. And I think this is what you were trying to say, Claire, that one of the really important things about the way that we approached this work was because the organisations that we partnered with, and there were some 15 across Australia, those were organisations that had already established and trusted relationships, which meant that they were there 5, 10, 15 years ago supporting the community before we even came in here and went, okay, we've got to work out how do we reach this community. And they would continue to support autistic individuals well after we left the building. So, and then even if we could actually access and fly all over the country to these communities, why the hell would they talk to us? Why would they trust us? And so I guess we borrowed the trust of those organisations and tried to equip them to have conversations with their own and do that in a way that we could report back to government in a way that they would listen. And I believe they did. I really, truly believe they did.
And I think we are already in the red line, but do you have a very quick call to action to anyone who is listening to us here or online?
I love that she asked the lady with ADHD to be very quick. Yes, you in your countries, like, let's get real. Autistic people need certain levels of support. And yes, it takes a little bit of hard work in the beginning to get it all set up right, but the outcome at the end will change not just the lives of autistic people, but it will change the way that you work more successfully with people with all types of disabilities.
Exactly, because what I believe in is that if something is working for autistic people, it's actually working for any kind of people.
That's right.
Anything to add, Cheryl?
Just the importance of working with and through others, and just not having the arrogance to assume that you can actually do everything yourself, and not having the arrogance that your neurotype can necessarily have the same conversation that other people can have if they're speaking to their own communities as well. And so I guess that's the challenge that I put to everybody, and think about in this context, in this conference, in all those meetings that you're having, thinking about what can you do together that you actually couldn't do alone.
And with that, I'm concluding this fireside chat. Thank you all for listening, and thank you for coming here from Australia to talk about this.
Thank you, Margaret.
Thank you.